Hello everyone, and thank you again for joining me in my latest Medicare Monday video. So this week I'm continuing on in my series where I'm covering topics aimed at individuals approaching their Medicare eligibility. This is to help enhance your understanding of what Medicare is, how it works, all its various looks and components, including how it all works together. So stay with me. So if you've ever benefited from or are currently benefiting from a health insurance subsidy under the Affordable Care Act, also known as Obamacare, also known as Covered California for those who are living here in California, you might have some reservations about transitioning to Medicare. Questions also often arise regarding ACA plans and Medicare, such as whether a Covered California plan purchased through the state's website can work in conjunction with Medicare. Or for those individuals who are turning 65, can they retain their Covered California plan instead of enrolling into Medicare? If these are concerns you share about Covered California and Medicare, stay tuned to discover the answers to these questions and more. Confusion regarding Medicare and the Affordable Care Act has been widespread among beneficiaries since the law's enactment. If you are currently enrolled in an ACA plan through the marketplace, you may retain that plan until your Medicare benefits begin. You then can cancel your ACA plan without incurring any late enrollment penalties. It is highly advisable to enroll into Medicare as soon as you're first eligible, which typically starts at age 65. Once you start receiving your premium-free Part A Medicare benefits, you'll no longer be qualified for a premium tax credit from your ACA plan. If you choose to keep that plan, you'll be responsible for paying the full price of that plan, which could be significantly higher, especially if you've been benefiting from a substantial credit that previously made your ACA plan affordable. But failing to enroll into Medicare at age 65 and opting to keep an ACA plan instead can result in a Part B late enrollment penalty. This penalty amounts to 10% for each 12-month period you could have had Medicare and will remain with you for the duration of your enrollment in Medicare. So, for an example, a 2-year delay would lead to a 20% increase in your monthly Part B premium, and this is for life. This may come as unwelcome news if your ACA plan has been largely subsidized. Nonetheless, being aware of these facts now allow you to transition to Medicare as required and avoid any future penalties. So here are some other popular questions I have had regarding ACA plans and Medicare. These will help you learn more about changing from the marketplace over to Medicare, and I think it will help you significantly. Stay tuned. So upon enrolling into Medicare, it's advisable to cancel your ACA plan, as both coverages are not necessary. However, cancellation is not automatic. You must actively cancel your ACA coverage by contacting the healthcare exchange. By being just enrolled in Medicare Part A, this will qualify you as being covered by Medicare, providing you with excellent inpatient health insurance, which then exempts you from paying any tax penalty associated with Obamacare. It is not advisable to sign up for any ACA plan in addition to your original Medicare. In fact, it's illegal for anyone to sell you an ACA qualified health plan to someone who is already enrolled into Medicare. You cannot have both an ACA and Medicare simultaneously, and it would be unnecessary because it would result in paying for two redundant coverages. So if you are enrolled in an ACA plan or a short-term medical plan, you will likely need to cancel that coverage once you enroll into Medicare. Many individuals use short-term health insurance plans to cover the period between the end of their employer coverage and when they turn 65 and they become eligible for Medicare. If you are considering keeping your ACA plan instead of enrolling into Medicare, be aware that this is not an option. If you, like many, qualify for premium-free Part A due to sufficient work quarters, remember that ACA coverage is not a substitute for Medicare. Failing to enroll into Medicare during your initial enrollment period can lead to significant penalties later on. Additionally, once eligible for Medicare, you no longer qualify for their subsidy premium tax credits that may make your ACA plan affordable. If you miss that transition to Medicare, the federal government will eventually impose a fine to recover any subsidy dollars you received for your ACA coverage after turning 65. There is one exemption regarding ACA and Medicare coverage. If you have not worked yet enough years to qualify for a premium-free Part A, you could choose an ACA qualified health plan instead of Medicare. For example, immigrants coming into the country often enroll into an ACA plan because they did not have enough credits to qualify them for a premium-free Part A. However, there are several complicating factors in doing this. Firstly, if you choose to re-enroll in Medicare later, you may be subject to late enrollment penalties for both Medicare Parts A and B. Secondly, if you are receiving Social Security benefits and opt to disenroll from Part A in favor of an ACA plan, you do risk losing your Social Security benefits and may have to repay any benefits already received. Lastly, ACA plans can be significantly more expensive than Medicare, especially when the subsidy that reduced the cost is no longer available. Often paying for Medicare Part A and enrolling in Part B can provide more benefits at a lower cost than an ACA plan. Estimating the cost of an ACA plan for those over 65 can be challenging, as most insurance companies' ACA quoting tools do not provide estimates past the age of 64, knowing that you are going to be transitioning into Medicare at age 65. So to avoid any gaps in health coverage, it's crucial to contact your ACA plan and request cancellation the day before your Medicare benefits start. Don't risk your health coverage by canceling your ACA plan too early. There's a 63-day window between the end of your ACA plan and the start of your Medicare plan. So, like if you enroll in a Medigap plan, they may enforce a waiting period for pre-existing conditions. Instead, maintain your ACA plan until the day before your Medicare kicks in. In the months leading up to your 65th birthday, work with a licensed insurance agent like myself to leverage your 6-month Medigap open enrollment period. This will allow you to roll into any Medigap plan without health questions. This will ensure a seamless coverage transition with your Medicare, Medigap, Part D, or Medicare Advantage plan coverage starting immediately after your ACA plan ends. I truly hope this video has provided clarity on your some clarity on your Medicare coverage and that transition. Don't forget to join me every week for my next Medicare Monday video, where I will explore more topics to assist those who are becoming eligible for Medicare. Should you have any questions regarding this topic or any other aspects of your Medicare coverage, please feel free to reach out and contact me by using the information provided below for a complimentary consultation with no obligation. Additionally, if you're new to my channel, don't forget to hit that subscribe button to get notifications for my upcoming videos. And if you found this video useful, you're more than welcome to like it by hitting that thumbs up button and or sharing your thoughts in the comment section below. My name is Danial Partridge. I am your independent Medicare agent. I hope you have a great day, and I'll see you next Monday. Thank you very much.